Hello everyone, it's another beautiful day and I'm very excited to welcome you to Talking Health with Dr. Laz, your most informative, educative and insightful health program on television. We are reaching you from your television channel of choice, the Africa Independent Television, AIT. I am Dr. Laz Eze. Since the onset of COVID-19 pandemic in Nigeria, there's been a spike in industrial disputes between health workers and their employers, as well as health professionals and the government. The most prominent has been the withdrawal of services by medical doctors. On June 15, 2020, the National Association of Resident Doctors, NARD, embarked on a nationwide strike action that lasted for 1 week. What were the issues that led to the strike, and what has changed since it was suspended? On the program today, I'll be talking about this with two resident doctors, Dr. Abah Robert and Dr. Nnanna. Both of them are presidents of the Association of Resident Doctors in their respective hospitals. Before we get into the discussion, let's check out some key demands made by the National Association of Resident Doctors before their recent national strike. The demands made by the National Association of Resident Doctors includes number one, budgetary allocation for residency training in accordance with the Medical Residency Training Act 2017. Number two was provision of adequate personal protective equipment, PPEs, for doctors and other health workers. They also asked for the payment of COVID-19 inducement allowance. The resident doctors also asked for the implementation of health insurance policies for healthcare workers. Number five among the demands was increase in hazard allowance, which is currently at 5,000 naira per health worker. The last but not the least was they also asked for improvement of working conditions, which they described as mostly inhumane and hopeless in state-owned tertiary facilities. You may recall that a lack of personal protective equipment has been cited by the Nigerian Medical Association and their affiliate organization as a major barrier to accessing healthcare in Nigeria. Many hospitals during this pandemic, there have been reports in a lot of hospitals during this pandemic of rejection of patients as a result of lack of PPEs. There's also been reports of alleged medical negligence in recent times. Dr. Nnanna is already seated with us in the studio, but right after the break, I'll be speaking with Dr. Abah Robert of the University of Abuja Teaching Hospital on the impact of COVID-19 on residency training, treatment of patients, and medical research. Please don't forget to join us across all our social media platforms that are displayed on your screen, and feel free to share your views and opinions during and after the show. We'll be right back. Please stay with us. I talked to Dr. Abah Robert. He's the senior resident in the Department of Surgery of the University of Abuja Teaching Hospital, Gwagwalada. He is also the president of Association of Resident Doctors at the hospital. He shared his thoughts, which were very insightful, and I'm sure you will not want to miss any bit of the interview. Please watch. Good to meet you, Dr. Abah Robert, President, University of Abuja Association of Resident Doctors. We're very excited to be with you, and the COVID-19 pandemic has really affected medical training, service to patients, and different aspects of hospital care. And recall that recently the Association of Resident Doctors, National Association of Resident Doctors, embarked on strike over a number of issues. So we want to really find out from you, generally speaking, how has COVID-19 pandemic affected residency training with University of Abuja Teaching Hospital as a reference point?
The COVID-19 pandemic has actually done a great deal to healthcare delivery in the country and worldwide, not sparing the residency training program. As residents, we have been badly affected with the COVID-19 pandemic. You know, residency is made up of three components: training, research, and services. And all these components of residency program has actually been affected. On training, you know, we are in a program that is town-bound. We're in the program that your progression depends on when and how you finished. So whatsoever impedes the training actually affects our lifestyle. It even affects how our future will be. So this COVID-19 pandemic has affected the training in the sense that since the pandemic started and affected the country, clinical posting, clinical training, our practical sections, all of them have been put on hold. Even academic presentations have been put on hold until after a while that we now devised that, okay, we can use some electronic form of teaching before we started academic presentation. But despite that, all the trainings physically on the ward that have actually increased our clinical acumen as doctors, they are no longer holding because of meetings could not go on. And all these are affecting our training. It's also worth to note that when we progress in this training, we write exams at different levels to progress to the next level. All exams have been put on hold. The National Postgraduate Medical College of Nigeria exam, the West African College of Physicians, West African College of Surgeons, exams were supposed to be taken between March and May, but all these could not hold because of the pandemic. And even the exams that were supposed to be taken have actually been combined with those to be taken from September through October to November. But all these are tentatively. Even though timetable are coming out, we are not sure of when the exam will hold. And this has actually affected us a lot. No progress, and the training is being affected. On research, we depend on our patients that also come to the hospital to even carry out our research. And because of this COVID-19 pandemic, we've not even had any opportunity, no ground, no environment good for research. So that has also been put on hold. And the third component of our training is the services. The services. And this is where it comes to patient's care. Services have actually been affected. We doctors, we took an oath. We're trained to take care of patients. And that is actually our work. We're actually ready to work. But this pandemic has put a lot of things on hold because you cannot ask people to be coming to the hospital. Not only that you don't want to be infected, but you don't also want them to be infected. Somebody can come to the hospital with a different ailment and may even get something else in the form of nosocomial infections or nosocomial diseases. So all this has actually halted a lot of things. No elective cases are going on surgically. Elective cases medically are not also going on. You see that all our outpatient departmental clinics are closed down. This is affecting a lot of persons, especially the elderly and those that have comorbid conditions. Even though we know that they may be stable, but you know their emergencies and urgencies can come at any time, and that can really affect these people and can even take their life. And then, because of the risks of the care and the caution that we also need to take too, there are situations where patients will say that, where the hospital will say that, okay, patients' load should actually be reduced, not a greater number of the healthcare staff should actually come to work, and all these are affecting a lot more. And for us also to protect ourselves, you know, we actually try to ensure universal basic precautions, but we need items that could actually help us. All these are affecting us as resident doctors. The availability of the N95 face mask, which we know that is the best to be used for protection. The availability of the personal protective equipment, the PPEs, which we know that when they are there, a doctor can comfortably and confidently attend to a patient, even a suspected COVID patient, even a patient that is even positive. This has actually gone a long way affecting the residency training program.
When the National Association of Resident Doctors, NARD, went on a one-week strike, there were some issues, some of the demands they made, and top among the list were number one, inadequate personal protection equipment. They want government to provide more. Number two, they want health insurance coverage for resident doctors as well as other healthcare workers. Number three, they want the payment of the special COVID-19 hazard allowance, which was approved around April. And they also want the state teaching hospitals and training centers for resident doctors to take certain actions that will improve residency. So I would like you to speak to this, starting from the availability of personal protection equipment. Does the University of Abuja Teaching Hospital have adequate personal protective equipment for the resident doctors as well as other health workers in the hospital?
Okay, thank you so much for this question. On the NARD strike, as a member of the Nigerian Association of Resident Doctors, the Association of Resident Doctors, University of Abuja Teaching Hospital, was not left out. We joined in the strike, and when the strike was suspended, we also came back. Actually, part of our demands were provision of protective items like the PPEs and the rest that could actually protect us. As at the time we were suspending the strike, yes, there were promises and there were commitments that more PPEs will be sent into hospitals. It was not that PPE were not sent to the hospital before the strike, but all we're saying is that they were not adequate PPEs and they were not adequate protection for us to work. And when those promises and commitments were actually made, we suspended the strike. But unfortunately, as we talk right now, it still boils down to the fact that the preparedness of the government for this pandemic has actually been the same. Because as we speak, the available PPEs on ground are grossly inadequate. As regards University of Abuja Teaching Hospital, we have PPEs, but they are not adequate enough to go around in all that we need to do.
Okay, when you say that you have inadequate PPEs, what do you really mean by that?
Okay, what we mean by inadequacy is we have emergency points in the hospital. Places like the accident and emergency, places like the theater, places like the gynae emergencies, like the labor ward, like the pediatric emergency wards, and rest. We actually expect that at any time T and at any point at work, when these PPE are requested for, they should not actually be sorted from elsewhere, but they should be in stock in all these places for use. Sometimes, because we don't have adequately enough, the supply to these emergency points are not also much. So when they get out of use, they have to also get this from maybe other stores or mobilize from other places where they are.
Thanks for staying with us. Coming to you, Dr. Agwu. Resident doctors and the federal government of Nigeria, under the aegis of Nigerian Association of Resident Doctors, reached a number of agreements recently around personal protective equipment and also around the use of, also around health insurance, also around so many things. You listen to your colleague, Dr. Roberts, from the University of Abuja Teaching Hospital, Gwagwalada. So what's your take on some of the points he made?
Thank you, Dr. Laz, for having me on this show. The Nigerian Association of Resident Doctors embarked on their strike on the 15th of June for about a week to press down some pressing demands that were issues that were affecting the resident doctors in Nigeria. Issues ranging from the inadequate provision of personal protective equipment, issues that had to do with the residency training funding, issues that had to do with the state tertiary health institutions. These are all some of the issues that the Nigerian Association of Resident Doctors had to deal with, including the COVID-19 issues surrounding it. The government made some promises to us, and it was based on that the Nigerian Association of Resident Doctors considered that with the plea and the effect on how COVID-19 is affecting the country and then we now thought it wise to suspend the strike that was called then.
So since the suspension and now, have you observed significant improvement, especially as regards the commitment the government has made?
Okay, thank you for that question. With regards to commitment from government, for my own hospital where I work, Federal Medical Center, Lokoja, some PPEs came into the hospital shortly after the strike, and we were made to understand that they came in from efforts of the federal government through the Federal Ministry of Health. We saw those PPEs, but as it is, those PPEs are still not yet adequate for us because some vital things that we need, such as the N95 mask, were not adequately provided in the materials we saw that was supplied. So,
but so some of these masks, we see a lot of public officers using N95 masks, and the World Health Organization actually said that it's health workers who are more at risk that are supposed to be using this mask.
yes.
What's your take when, from what you're saying, you don't have adequate N95 face mask, but almost every day on television, we see public officers using it?
As rightly put forward by the WHO, N95 is the most critical thing, part of the PPE that is needed in the protection against COVID-19. COVID-19, as we all know, spreads mostly through aerosols, through the respiratory tract, as it is, which has warranted a lot of advisories being put forward on how we can do to protect ourselves. So it is a key component of the PPE that is required, and this is what is needed in most of the emergency points in the hospital. So we can only appeal to the government to, provide more of this in addition to the things that they are already providing. But we, at this point in time, cannot say that the PPEs are adequate for us to help to protect us in the course of our work.
Okay, that brings me to the next question. Yes. On 1st of July, something happened in your hospital, yes. Federal Medical Center, Lokoja, and even before then, there's been a lot of different stories between your hospital and the government of Kogi State. Yes. And there were news reports of gun attack in your hospital, and since then, we learned that it's been on shutdown. So can you tell us about the incident of 1st July 2020?
That incident that happened on the 1st of July is quite an unfortunate incident, that you will have hoodlums come into the hospital and destroy hospital equipment and destroy materials, which also endangered the lives of our resident doctors who were working there. It's quite an unfortunate incident. However, the security personnel are looking into it. All the relevant authorities, we understand, are also looking into it, and we hope that in a short while, those issues will be resolved so that we can get back to our normal work.
Okay, they are looking into it. Are there preliminary findings yet that you are aware of on those who could be suspected to have carried out this?
Well, I can't, I don't have such information at my disposal at this moment. But what I know is that both the police, both the hospital management, the security agencies, the ministry, and even the hospital boards, they are all looking into it to find a lasting solution to such that such incidents will not reoccur again.
Are there hopes that the hospital can reopen anytime soon?
Yes, we are hopeful that in a short while that the issues should be resolved, and then
some persons were pointing accusing fingers on the Kogi State government, that they know something about the incident. Do you agree with such suggestions that based on some events that were happening before that incident, that they possibly could have known about it or could have possibly been responsible?
Well, like I said earlier on, I think that lies in the purview of the security agencies. They are investigating, and then they are going to find out those who are responsible for it. And we strongly believe that the security agencies will do a very good job in finding out the exact culprits and those who are doing this. So we are hopeful that the security agencies will do a good job so that such incidents will not reoccur again in our hospitals, because of the danger it portends to both the staff of the hospital and the workers and the patients who are also coming to access care. in our hospital.
Okay, thanks for that. Some of the issues that were happening before that attack on the hospital had to do with COVID-19 testing. You know, are there hopes that when the hospital resumes, that COVID-19 testing will start taking place at Federal Medical Center Lokoja?
Those are the issues that are being looked into at all the whole level of care. You understand that healthcare is comprehensive, and it involves a lot of stakeholders. You know, so it's our understanding that both the state governments, the hospital board, the hospital management, and all relevant stakeholders are looking into these issues to come to an agreeable solution that will be lasting, that will benefit, that will be to the greatest benefit of the Kogi State indigents.
Okay, Dr. Nnanna, residency training in Nigeria has a whole lot of challenges. I know, like your colleague Dr. Abah said, residency training has a lot to do with service delivery for the patients, because while undergoing the specialist training, the doctors are also gaining experience, and it also has a lot to do with services on the patients. It has a lot to do with research. Going forward, which areas do you think that the government of Nigeria at the state and the federal level need to do better in support of residency training? How can we make residency training better, you know, for the interest of the patient, and also to serve all the, meet all the requirements and also the provisions of the Medical Residency Training Act 2017?
Okay. Like my colleague said earlier, the residency training is divided into 3 parts. You have the training, you have the research, and you have the service delivery. All these are all intertwined in the course of the training. And the way the government can come in to do this is to ensure that the Residency Training Act, which has been signed into law, is strictly adhered to. While formulating that act, we understood the peculiarities that are associated with residency training, and it is our strong belief that if the act is applied by the relevant institutions, by the hospitals where residency training is going on in the country, it will help to curb a lot of issues that the resident doctors have with the government or with the hospital management. So most times where conflicts come into arise is when some parts of the Residency Training Act is not being followed as it is. But that aside, you know, the government can come in by funding residency training adequately, funding in the sense of supporting researches that are ongoing, supporting update courses and exams that these resident doctors embark on. And not just that, they need to support through provision of avenues for doctors to get grants for some of these researches, for researches that are ongoing, because research is a core component of the science of medicine. Medicine cannot develop, medicine got to the place where it is today as a result of researches that are being done in the time past.
Exactly. Talking about research, are there grant donor agencies in Nigeria or private sector institutions that resident doctors apply to access grants, or do you rely on foreign support, you know, for grants or for research grants?
Well, to the best of my knowledge, there is no coordinated avenue for resident doctors to access grants. However, individually, based on societies, medical societies you belong to, like I am an anesthetist, based on the Nigerian Society of Anesthetists, you have opportunities to access grants or fellowships abroad or even within to embark on some programs that you may wish to embark that will help to improve you in the specialty where you wish to specialize. So these are some of the, and we also understand that most times it's mainly through individual effort or through resources, maybe online and all that. You get this information and then you apply. And then some of our members also benefit from that as well.
Okay, that's very good. So lastly, what are your parting words to Nigerians or to anybody viewing this program? What do you think they need to know about the residency program, and what do you think the authorities need to do in specific terms? Just your last words.
Okay, thank you. Residency training program in Nigeria is a tenured program, and it's a program that is designed to increase the specialist manpower for Nigerian healthcare system. Resident doctors, resident doctors are there to serve as they are serving, and they also get trained, all to the benefit of the country. I will want the government and those watching us, majorly the government, to increase the support and the funding of the program. This will go a long way in ensuring that the healthcare system in Nigeria is fortified and gets the relevant expertise that is needed to move the country's healthcare system forward. Yes.
Thank you, Dr. Nnanna, for joining us on Talking Health with Dr. Laz. I've been speaking with Dr. Nnanna. He's a senior resident in the Department of Anesthesia at the Federal Medical Center, Lokoja. He is also the president of the Association of Resident Doctors in the same hospital. And over the past few minutes, we've been talking about residency training in Nigeria and how COVID-19 has affected it. Thank you very much for being part of the program today. That's the much we can take on Talking Health with Dr. Laz. We thank our guests, Dr. Nnanna and Dr. Abah Robert, that talked to us. Please watch out for this same program this time next week, same time, same station. But note that conversation continues on our social media platforms. Follow us and send your questions, opinions, and we will find time to provide answers to you. Thank you, and join us again.